Assalamu alaikum, doctor. Okay, sorry I was not able to reply you on time. Okay, let's just evaluate your letter. That is fine. This is okay. Miss Bethany Taylor, this is fine. I'm writing to update you regarding Miss Taylor, who has been making clinical recovery after being treated for decompensated schizophrenia. Your further ongoing care would be greatly appreciated. Okay, rather than writing who has been making clinical recovery and making things difficult for yourself and a bit little complicated, you can just write uh, Mrs. regarding Miss Tyler, who has treated for decompensated schizophrenia. That's it. On the state, Taylor admitted with the complaints of delirium, visual hallucinations, and auditory command hallucinations, which were telling her to harm herself. Moreover, she was non-compliant with her medications. On examination, she appeared agitated, aggressive, and responding to stimuli with thought blocking and latency. Therefore, antipsychotic medicines were recommended. Sorry, were commenced. On the next day, she stopped reporting auditory and visual hallucinations. However, disorganized thinking were still present. Was present. There were no signs of thought blocking, and she was able to focus on activities of daily living fine. Regarding nursing management, Miss Taylor was assessed for objective signs of psychosis along with redirection from deliriums. Moreover, immediate medication compliance was ensured. Furthermore, she was helped to maintain her behavior control with the help of therapy. Okay. Today, Miss Taylor, I guess it should be O, has been making good clinical progress. Chronic mental illness can decompensate, right? If she is not compliant to her medicine, or if she use, okay, so it should be uses, okay, uses up than any substance again. Now she has good insight and fair judgment. Okay, so the problem is, if this is fine that you're writing this way, but if you mention over here that her condition can decompensate and this can happen and that can happen in this paragraph, I don't think that would be appropriate. Okay, rather than this, just write that her judgment is fair, insight is good, whatever, and write the discharge plan like the way you have written down here. Regarding her discharge plan, she is being discharged on risperidone program per oral at night. Moreover, risperidone 1 mg twice daily if needed for her agitation or psychosis. That's it. Okay, there should be no advice and stuff. Okay, so that should have been written over here, and then you can write over here that because this is an update letter and she recently had abused substance, so you can write that please note she recently abused substance, and there was a date mentioned as well, right? So you can write that here after the just before the conclusion, and there you can write that please note that her situation or condition can decompensate again if she uses the substance. So that should be more appropriate rather than messing around here, and and that is not making proper sense as well. And you can't make two paragraphs of a single visit and a discharge plan separately, and you're telling me this can happen and that can happen. So it's not a good way of writing. Otherwise it's fine. So I'm not satisfied with this today visit, and it is the most important paragraph, and I have to unfortunately give you less score because there is no compromise on today's visit. Thank you so much.